Suicide is one of the leading causes of death in children.
WDRB Stefan Johnson explains the warning signs and what's being done to help navigate kids through a mental health crisis. Stefan?
According to the CDC, the rates of suicide, self-harm, anxiety, and depression are all up among children, but health officials are hoping that the new 3-digit lifeline and Suicide Prevention Awareness Month will help stop or at least slow the trend.
Her mother actually discovered her body.
Several years ago, a bad day at the office turned tragic for Richard Farmer's daughter.
She called a friend, and the friend asked her, said, well, let's go out and, let's go out and get something to eat and whatever.
Farmer's daughter died by suicide, but he often wonders what would have happened if she had reached out to the right people for help.
Had there been an easy way and a well-known way for her to get help, it may have made a difference. I don't know if it would have, but it may have made a difference.
September is National Suicide Prevention Awareness Month and a chance for health officials to share potentially life-saving information.
I think it does start with a conversation.
Dr. David Hovenagel is a lead mental health therapist with U of L Health Peace Hospital and says starting the conversation with direct questions could help save lives.
Are you okay? Are you having any thoughts of being depressed? Any thoughts of being hopeless, helpless? Or even, are you having any thoughts of ending your life?
According to U of L Health, suicide is the second leading cause of death for ages 10 to 14 and 25 to 34.
There's statistical support that COVID has very much worn on us.
Health officials say not only has COVID exacerbated the situation, but there's an alarming number of children being brought to emergency rooms because of mental health issues.
Kids are frequently brought to U of L Peace Hospital after going to emergency rooms for suicidal attempts.
But there is hope. In July, the call for help got a lot easier when 1-800-273-TALK changed to 988, similar to 911 for medical emergencies.
So this is, to me, very positive that government is getting involved in a much more direct way, making this unified system of being able to call from when you are in trouble or when someone you know is in trouble.
Meanwhile, Richard Farmer will never know if the lifeline could have saved his daughter's life, but he often wonders.
It would have been a nice option to have had.
If you or someone you know are having suicidal thoughts or suffering from anxiety and depression, again, the new suicidal lifeline number is 988. With photographer Jeff Gordon, I'm Stefan Johnson, WDRB News.